The United Nations Relief and Works Agency has started its polio vaccine campaign in Gaza today. The organization says polio vaccines have arrived, and it will be part of vaccinating roughly 640,000 children under the age of 10. Joining us now is Rachael Cummings from Save the Children. She's in Gaza right now. Rachael, thanks for being here.
Thank you for having me. Thanks for the opportunity.
Of course, and this war between Israel and Hamas rages on. Let's have you start by telling us exactly where you're located and describe what you're seeing around you every day.
Yeah, so I'm calling in from Deir al-Balah, which is in the middle area of the Gaza Strip, and we relocated here in May following the incursion into Rafah in the beginning of May. But the situation in Deir al-Balah, Khan Yunis, and across the whole of Gaza is extraordinary. And the situation for children is absolutely dire. As you said, the war continues, the ongoing bombardment, the continuous drone activity, the continuous fighting across Gaza, and also, of course, the forced displacement of families and children continues into now becoming 11 months, which results in children being moved from inadequate shelter to inadequate shelter time and time again. Even our staff are being having to relocate and evacuate from areas that are deemed unsafe, having given evacuation notices from the Israeli forces. So the situation is very kinetic, it's very fluid, it's very complex. But the reality for children is absolutely extraordinary. There has been no education for any child in Gaza since October. So children are everywhere. Outside, you see children everywhere in unsanitary and unsafe conditions. Now we have challenges of obviously access to water, but the sewage systems are broken, which means you have sewage, open sewage in the streets, and people walking through open sewage. As you can see there in the photographs, the situation is terrible. The smell is incredible. The heat, flies, absolutely awful.
Tell us more about what Save the Children is doing in Gaza, because I know you're there to help this situation.
Yeah, Save the Children's been working in Gaza for decades, and since October we've been working with our partners, Palestinian partners, who've been doing an amazing job. And Save the Children now also providing services to children. We're running a health centre, we're running nutrition points in communities. We know that malnutrition is a major concern and a major risk for children. Children are dying unnecessarily because they are malnourished. So finding children in the communities that are malnourished and then giving them the treatment that they need, also trying to prevent malnutrition. So Save the Children are running child protection services as well. Trying to provide some relief for children, some psychosocial support, some well-being support for children and their families. But, we're scratching the surface. It's absolutely not enough. We're providing water trucking, doing some minor rehabilitation. But again, we know that it's not enough. Our health centre is one of the vaccination sites, and today we vaccinated around 1,800 children alongside WHO and partners, which is a great achievement, but there is so much more to do, not only for polio, but for all the vaccine-preventable diseases.
Really, this whole polio campaign sparked from a baby that contracted polio and is now partially paralyzed. So it really is deeply and gravely affecting children. What are some of the challenges you might face in this vaccination campaign?
Oh, there are huge challenges. We have a large, sorry, let me start that again if I can. There are huge challenges. We have to engage with communities. We have to talk to communities so people understand, generally mothers understand the importance of vaccination. And we're lucky in Gaza that they had a very high vaccination coverage before the war. But of course, there are risks for people going from one place to another in Gaza, from traveling from their shelter into a clinic. There is risk in that. So communities, parents need to trust that the vaccines that will be there, that the staff will be there, that are trained and able to provide the services. And they also have to trust that they will not be put at risk by traveling and entering a health facility. And we know throughout this war, the health facilities have been targets. So it's very, very concerning. It's very high risk. Yeah.
That does bring me to my next point. The United Nations was pushing for a pause in fighting for this campaign, and it sounds like that's happening. However, with the latest news of the 6 hostages found dead today, are you concerned for your staff and the people of Gaza during this time? I mean, like you said, they're going to be traveling from point A to point B to get these vaccines. There must be some safety concerns there still.
Yeah, absolutely. I mean, there's constant safety concerns, and we're deeply concerned about our staff, their families, and all the children across Gaza. There has been a potential lull in activity in Deir al-Balah today. Less drone activity, less sounds of gunfire, etc. But again, it's very precarious. It's very fragile. We do not know what the next hour is going to bring. So we're always deeply concerned about the safety of our staff and the communities around us.
Rachael, we appreciate this. Thank you so much. That's Rachael Cummings from Save the Children in Gaza.
Thank you.